All right, so how this is supposed to work, I'm going to give the update, and then also I think Megan's going to text me questions that we might be getting from the media. If you are media and you just kind of post a question in the chat section from this page, from the Mayor of Wichita page, that will, I think, help me out as well. So feel free to do that. We got about 50 people watching at least. And then, of course, right when we start this, again, a whole bunch of people text messaging me. So I'm trying to stay focused here. All right. So again, we are quarantined over at City Hall. Let me pull up my notes here. And that's why we're doing a remote update. So bear with me. Let me go ahead and get my notes. Any chance I could flip my camera horizontal? I'm not sure. I'd have to figure out a way to hold it horizontal. I have like kind of a stand here. So I'm not sure, Yasmin, if I can. Sorry, I don't know if I can do that successfully. So I don't know. Megan might be able to put something in a better format if you need it. Okay. So my notes for today. All right, so first I want to give everyone an update on our progress with our library in the 3rd District. Right now, we are moving forward with having our library, it's a satellite center in our 3rd District, which is a lot of pretty much south and a little bit of central Wichita. We're having a competition on naming it. So if you are someone who is interested in submitting a name for the new library, please do so by completing a survey at wichitalibrary.org. And then our library board of directors will meet on Tuesday, November 17th, to narrow down a list of submissions, down to 5 submissions at that point. And those 5 we'll look for more engagement from residents. We have to figure out which 3 should remain. And then, of course, we will eventually work on whittle it down to 1. But we want community input on this. And so if you have an idea for a really good name for our library that's opened up again in the 3rd District, satellite campus or satellite center, please submit your recommendation to visit wichitalibrary.org. All right, also, I want to talk about, and this one's kind of fun, our Kansas Read to Preschoolers program. On Sunday, November 15th at 6:30 p.m., the Wichita Public Library will premiere its Kansas Read to Preschoolers video on YouTube. If you have young kids like me, take time to watch this special program. Our youth service librarians will teach children about ice cream and dinosaurs, which sounds amazing, right? So we'll be teaching about ice cream and dinosaurs in response to this year's chosen book, which is Groovy Joe, Ice Cream and Dinosaurs. Kansas Read to Preschoolers is an annual event that promotes reading to all Kansas children from birth to age 5. Through the statewide program, parents, librarians, caregivers are encouraged to read the chosen title during the month and participate in activities. Sorry, I had one of my kids come out. Don't worry, they're clothed, so if they get on camera, it won't be scandalous. So this year, for a full list of the activities, please, or for free access to the book, please check it out at wichitalibrary.org/pre-K. And I just can't talk enough about how many incredible resources we have at our public library that is at our fingertips. So if you are someone who, just some feedback I've gotten from this weekend, if you are someone whose kids are now working remotely and as a parent you are figuring out their learning style, then some people we're finding learn really well with audio, learn well online, and you're looking for some supplemental resources while still staying, at home, not getting out there and really exposing yourself to the virus, check out our Wichita Public Library. There is a ton of resources that can be downloaded including audiobooks, including actual traditional textbooks that you can download and use on an e-reader. Really some amazing stuff that we have now available that I'm not sure everyone knows about. And it's a good opportunity to supplement the learning for some of us parents who have our kids at home and they don't have access to the same type of stuff they normally would at school. At the city level, our libraries are amazing and we can actually help supplement some of that. So with that, I'm going to get into a COVID update. This past weekend, you might have heard that Councilmember Johnson tested positive for COVID-19. My fellow council members and multiple staff members, we went and got tested. And luckily, right at this moment, no other council member that we know of has tested positive. Out of an abundance of caution, of course, we are going to maintain our 2 weeks. Our 2 weeks of a quarantine, because sometimes you could get exposed to this and you could test negative, and you got to monitor your symptoms because it might take a few days for you to be in a position where you can test positive. So I am working from home, and that should be obvious to the people who are tuning in right now. So I want to talk about this for a couple of reasons. We are seeing a spike in our numbers, and first off, I do want to thank Brandon Johnson. He actually did everything right. He came in and he immediately recognized his symptoms, alerted us so we can clear out the office, went and got tested positive, and because of his recognition of the symptoms and the fact that he didn't try to, talk it away, like he wasn't, well, it's probably nothing. He took it serious, got a test right away. In doing that, he probably saved lives. We have folks who work in our office that are in that high-risk category, who are above age 60, who might have some other underlying health conditions, and really just a small, inconvenience of going to get tested resulted in us not passing this throughout our staff or throughout the electeds at City Hall. And so Johnson right now, please keep him in your thoughts and your prayers. He is recovering with mild symptoms. His wife reported that she also has symptoms or has COVID, as well as their daughter. So please keep them in your thoughts. But so far, it seems that he is doing well. So with that, I wanted to talk about how we have our numbers of COVID are increasing. Now, we're in a weird spot right now, not a weird one, but a unique one when it comes to this virus. Normally, we're looking at lines on a chart, right? And we're seeing it kind of go up, and a lot of the debate is focused on what does that mean? Does it mean that the data is accurate and we have our numbers climbing? What does it mean when it hits 15%? What does it mean when it hits 20%? What is the practicality of, this virus kind of exploding in our community? At this moment, we are no longer talking about lines on a chart. We're talking about capacity at hospitals. So while we're around 20%, we are increasing. The lines on the lines on one thing, they're an indicator that this is climbing. But really, the practical aspect is, do we have hospital beds? As was reported earlier this week, our hospitalizations have doubled from last week, or nearly doubled from last week, and nearly doubled from the week before that. We're at the point where we really don't have as many ICU beds or access to ICU beds as we normally do. We're close or at capacity. Now, the hospitals have a couple of levers they could pull, to kind of move things around. But as this gets worse, they run out of more options. So we're at the point now where if we don't start changing behavior today, which will hopefully lower the numbers in 2 weeks, because as we've talked about, it's about a 2-week delay, we could get to the point where there's not a hospital bed for you. If you show up with chest pain and they don't have a bed to admit you in, and you're not having a heart attack right then, you'll have to go home. And, God forbid you have a heart attack at home and pass away from that. That was a preventable death. That was something we could have prevented, but because of the capacity issues, we weren't able to give the care that Wichitans deserve. Now we see Tulsa, I think, according to NPR, has already reached capacity at their hospital. This is common, and this is really what the bending the curve was all about, is do not have a rush on the hospital or else we're going to be in trouble. So, with that said, we are seeing that the county, and remember, I can't express this enough, the county commission, which is a separate governing body than the city, is in charge of health orders as far as coming down from their top health expert, which is Dr. Menz. Not the city. I get a lot of kind of pushback where, hey, you're the one making these health orders. I am a useless doctor, by the way. I have a doctorate degree. It's not in medicine, and I promise you I'm not the one making these orders. My job is to analyze this policy and these orders and try to explain them and promote them to the public so that we can all lower these numbers, keep our economy afloat, and just as importantly, if not more importantly, protect and save our vulnerable citizens, our grandparents and our parents. So with that, some orders have come down, which will have limits on capacity for businesses and restaurants and just pretty much any place that brings a lot of people into one spot. I believe that they have dropped down to 50% of normal capacity. And of course, mask mandate. Masking right now we know is the most effective way to slow down the spread of this and to stop the spread. If everyone's wearing masks, we will be in a much better position as far as the numbers go. When we had our mask ordinance in place, we got our numbers down to 5%. Now, even though our mask ordinance has expired, the county mask order is still in effect. So we are still under the county mask order, which means we still have a mask mandate. There will be some discussion this week about enforcement, about how we can come alongside the county commission and help when it comes to enforcing these orders. And usually with enforcement, what we want to do is we want to aim at really, bad actors. And by that I mean not the people who might not be, who are, going about their business and create a social gathering that might not, they might not know that the new orders came down. So the first part is to educate and to talk to them about what the changes are. And then the next part, if people just choose to be defiant, where they, we're talking, they just don't care at that point, then reporting that back to the county and allowing them to take action. I believe the county has a $400 ticket fine. So what we don't want to do is chase mom who goes into the gas station and leaves her mask in her car. We are not looking at this point to really crash down hard, I think, on individuals. I think we're looking towards the type of businesses that bring people into a room and make a lot of money by bringing a lot of people together and are doing so knowing full well that they are putting those people at risk and putting our entire community at risk. That's the behavior we're hoping to alter just for now. Our goal is to get back to normal, get our numbers down, and get us through the next few months. As most people know, we are pretty close to a vaccine. And once we actually get the vaccine, we then have to actually get it in Wichita and find a way to distribute it to those people who actually want it. And at that point, it's a bit of a game changer because it's no longer me wearing a mask to protect someone else. Now that someone else actually has it within their power to protect themselves by getting, taking one of these vaccines that are showing to have promise. Now we're a few months away from that, so we got to close the gap now by using the methods we know, which is making sure you're wearing a mask, making sure that if you are sick, you get tested. We are opening up more opportunities for testing in our community with saliva tests and with faster turnaround. So hopefully we can talk about some of that in the upcoming week as well. Wichita State just brought their lab online. We had the governor down at a big press conference about that a couple weeks ago. Well, what does that mean? It means that we're going to have access to really fast testing. Also, we have to talk about some of our cultural traditions that are going to happen when it gets cold out. for this whole time, we have predicted that when it's cold out, people are going to go indoors and they're probably around friends and family, and their mask will come down. Because that's just kind of what we do. We trust the people we're around that they're not sick. The problem with this virus is a lot of times you have it and you have very little to mild to sometimes no symptoms before, while also being contagious. That's one of the things that makes this virus unique from other viruses, is you actually are contagious before you have a fever, before you even know it. And we saw a bump after Labor Day. I can only imagine what Thanksgiving will bring us, right? Like, where if we don't have people who are vigilant, who are either creating smaller groups or having safer interactions, we're going to have good people who think they're okay, who think that they don't have this, who are going to have big family dinner and then pass it along to mom or pass it along to grandma, who will wind up in the hospital right now, which is already at capacity. That's what we want to avoid. So please plan. If you are someone who is going to have a family gathering, please try to limit your contact, at least days before, so that you have time, if you have symptoms, to get those symptoms checked out. Please, if you could get testing before you have your family gathering, that would be helpful. I've spoken to some people in a business community who have mentioned that they are doing stuff like, if you go to Thanksgiving, you're remote learning or remote working for 10 days after Thanksgiving to see if you caught this, so that you're not spreading it to your fellow employees at work. I think that there are ways we can attack this while being smart and utilizing our strategy as humans. We're smart, we can strategize, and we're fighting a dumb virus. Like, we know how it spreads, and all it wants to do is cling onto a host. It's literally just this dumb virus, right? So our goal with this, by knowing how it spreads and knowing it can adjust, it's not trying to outsmart us. We can use strategies to stop the spread of this, and we really have to at this point. Once our numbers, they're around 21% right now, and we're at capacity. A lot of countries shut down their economy at this time. A lot of countries, when they hit this, they do full stay in, shelter in place type orders. This is the last Hail Mary before something like that might come down, and I don't make that call, might come down from a higher authority, right? From the county or the state or somewhere else. Let's do what we can now to get this thing under control. We did it before. We beat the crap out of these numbers before. Got it down into the single digits. Got it down into, I think we were under 5% spread at one point. We can do it again. We just got to get off the ground and actually face it and fight it like it was any other opponent, right? Like, fight it like it was any other invading force here to make our loved ones sick. So with that, we will stay up to date, or keep you up to date with the newest numbers and also the newest policy. And again, it's coming from the county, and it's also coming, I think we're going to see some stuff maybe from the state level, maybe from the federal level. My job is to relay information to you that might not be popular information, right? So, but just know, in a lot of situations, I'm the messenger. I can't make changes to this because I don't serve on the county. I don't serve on some of these other places. So, please, let's remember we're in this together, and we all have a real chance to beat down these numbers and get back to where we need to be. All right. So I just got a text. I don't think there's any questions from the media yet. If you are from the media and you have a question, put it in the thread, and I will take questions. All right. Ask a teacher. They're experts. I'm not sure what that comment was, but teachers are amazing. Okay, Megan Lovely from our PR department said that they are going to pretty up this video, so it might be better for those who wanted me to turn this sideways. Very sorry I didn't do that. And of course, Megan, if you're gonna pretty it up, if you can add just a little more to my hairline, that'd be great. Brian comes in with his wimpy Whipple, the mayor is a joke. Thanks, Brian, for your intelligent feedback. David Dean writes, we know how it spreads, and in-person sports doesn't spread it, even though the doctors say sports is dangerous right now. I would caution when it comes to how this spreads, let's keep in mind that it's not so much like the activity is, are we bringing people together who actually are unprotected, no mask, and around each other for 10 minutes or longer, okay? Do you have that chance of getting droplets, which comes when we talk, and it's really, I guess it's kind of disgusting, right? We never thought about this before, but when we talk to someone, you're getting these droplets, and that's carrying the virus. So it's not so much as like, well, we don't see it from here or there or there. It's really about not like it's about gatherings. It's about bringing people together and doing it safely, not about what they're doing. Okay, so there is no safe activity to gather with a big group of people when you're within 6 feet of each other without masks. There is no way to do any of that safely at this point. It doesn't matter if you're playing basketball. It doesn't matter if you're at a bar. It doesn't matter if you are at family dinner. Unless there's testing, unless there's some type of pre-screening. So that's really kind of, I think, where we got to shift some of this conversation. Not so much to, well, we don't see it here, here, or here. It's not the activity. It's, are we bringing people together without masks and without any type of, I guess, screening. Okay, so, good, we got a media question. Do you think a shutdown in Wichita is possible in the upcoming weeks? Really, I don't know, to be honest. I think that would come from the county. I think that we would be in some very extreme situations for that to happen. But when we talk about the hospital not being able to take care of folks, like, we need a place for pregnant women to go if they're in labor, right? Like, we need a place for people who are having heart attacks to go so that they can be saved. And these are extreme cases, right? Because like I said, there's some levers that they can pull, but they're pretty maxed. Like right now, hospitals are bringing in traveling nurses. They are having nurses and medical assistants sign up for extra hours, which they are, because here in Wichita, people rise to the challenge and face this head on, and our medical community is doing that. Like, you know, I can't tell you enough how much respect we should be giving to our medical community. There are people who are working double time right now, and they're taking these extra shifts. The problem is, if those people get sick, if those people are quarantined, if we start seeing kind of our frontline, workers, or really think of it like frontline soldiers here, if they start needing to leave the front line because they're sick, then, what do we have next? We want to avoid a shutdown. The way to avoid a shutdown is to start beating these numbers back now by using the precautions we all know about. I mean, we're 9 months in this. We all know how to prevent this. We got to get back to that. And also adhering to these other precautions that our the top medical advisor over at, or officer over at the county commission, let's listen to this person. Let's listen to the person who's an expert on this. So hopefully not. I think it would be extreme. But again, that's not my call. That's over at the county. But I could see, if we continue to have just uncontrollable spread, there might be some more drastic stuff. But good question. I mean, I'm just speculating. That's a good question. Probably the worst answer, because I don't know. But we take this, I guess week by week. All right, something's beeping. So are you guys giving me more questions? All right, so if there's no more questions, I'm going to go ahead and get out of here and let you guys get on with your day. I'm completely just froze everything. Sorry about that. Okay, guys, so I will be quarantined, and thank you so much for being here. So Troy is coming in with a fact that is absolutely false. Our hospitals don't always run at 80 and 90%. If they do, they have more flexibility. This is actually a big problem that the hospital leadership has stated is a big problem. This isn't normal. If anyone comes on and says, oh, this is normal, we always have, I guess, an extra 5 200 people hospitalized each week for one virus. That's wrong. We are in a literally uncharted territories right now, and this isn't my opinion as a non-medical doctor. This is literally the president and the chair of our 2 hospitals in Wichita who reported this to me directly on Monday. So if anyone's on this thread saying, oh, it's not that bad, it really is bad. So please, let's do what we can to make sure it doesn't get worse. All right, thanks a lot, guys. Take care.